first thought when I see a sciatica patient is that what causes sciatica? And as we've discussed, it's compression. So I need to design my manual therapy around decompressing that disc. Okay, so there's a lot of traction in work, very gentle, very subtle. There's no big fast pull, nothing like that. It's just gently starting to traction the legs, kind of stretching people out, you could say, and that kind of elongates that disc. And as that disc kind of stretches, it reabsorbs back, because all discs do heal and they will reabsorb, and if it was a herniation, then they will reattach and they will re-strengthen and they will go back to their original place. So when I see a patient, I start to instantaneously decompress. After I've kind of stretched out their legs, kind of feel, okay, is this more of a left side issue? Is it more of a right side issue? From my mentor up in Mid Wales, he's taught me, which I see a lot with sciatica patients, is that typically speaking, in my opinion, I tend to see right-handed people have left-sided sciatica and vice versa. And that's because of our weight bearing. We do tend to do with one side. I'm a right-handed person, so I do a lot with my right. And then we tend to balance on our left. And if the patient is particularly a little bit too sore on that, say, for example, that left side, it's a left-sided sciatica, I'd start decompressing on that right side, because it might just be a little bit too specific at that time for that patient. And the whole point of being in the clinic and having a manual therapy is transition patients from a point of pain to ease, not to cause more discomfort within the clinic. They're kind of getting better. It doesn't work like that. It's to get them initially straight out of pain. Then I would have a look at their pelvis. The pelvis is the absolute foundation of the body, and you've got the sciatic nerves and the discs that sit on top of it. So you typically see people's kind of hips, they might be like unbalanced. I don't believe that they're unaligned. I don't like using that word personally. I don't think anything is unaligned. We're all very unique in our own ways. But again, our lifestyles kind of dictate our posture. So when I work with people's pelvises, I'm kind of like moving their hips. I'm kind of feeling, okay, where does the legs want to go? Where don't they want to go? Or where are they a little bit grumpy in the middle? If I can find that barrier, I don't need to push over it. I can just kind of encourage it. And then we can gently start the traction. We can use techniques for mobilizations, which is taking a joint to its normal range of motion to try and encourage more healthier movement, which is what we are trying to constantly achieve, is to get that patient feeling pain-free but comfortable enough to stand back up after a manual treatment at the clinic and then kind of be like, okay, this movement isn't as uncomfortable as it previously was. That is the start then of where that patient will start to really heal, you know, through the process of the treatments, and which can range from anywhere from 4 treatments to 6 treatments to 8. It just depends on how severe this sciatica really is. But then afterwards, it's about trying to transition that patient from point A to B to C. What do they initially want to achieve in the clinic? Most of the time when it's sciatica pain, it is extremely painful and they want to get out of pain. And we can help them with that. We've proven it a lot within the clinic, you know, and as we transition them out of that pain, they're still not out of the woods. You know, there's a lot that still go on. And then this is where we come as an advantage at the clinic. We've got the rehabilitation, we've got the chiropractors, we've got this multifaceted approach to deliver specific care at specific points of the journey. It's not just a quick fix in and out sort of thing. It doesn't always work like that. And you can transition patients from point A to B and get them out of pain. But then there's work also that needs to be done to kind of re-strengthen and rebalance the muscles to make sure that they can prevent another episode, so that they don't always have to come back, because we want to educate patients on how to change their lifestyles so it doesn't trigger again, how best to self-manage it with ice or heat, and to get some manual therapy when it's needed and get that expert opinion when they really need it the most.